Hi there, I'm Anna and I'm a Paediatric Occupational Therapist, and today we're going to be talking about what is occupational therapy. It's the question I get asked a lot. Any kind of social event, anyone ask you what you do for a living, most people don't know what occupational therapy is, so I've got quite used to explaining, and I think it's quite helpful to just keep it brief and simple. When I explain it to kids, I most often say, I'm a doing therapist. Anything that you've done in your day, I'm interested in. Whether that's getting out of bed in the morning, brushing your teeth, having breakfast, getting dressed, going to school, writing, playing football, coming home, anything that you do in your day, I'm interested in. And my job is to make sure that you can do it to the best of your ability. And I really enjoy my job. It's a fabulous job. It's really rewarding. It's really fun. Every day is so different. And basically, as an OT, we look at different areas of life. So we look at self-care, we look at productivity, and we look at leisure. And they can vary for different roles and different people. And OTs don't just work with children. They work within a whole age range and a whole different variety of settings. Physical settings such as hospitals, helping to facilitate hospital discharges, such as people recovering from surgeries or strokes or kind of acquired brain injury, and helping those people to get back on their feet, so to speak, and back living their lives as independently as they can do. And also within a mental health setting, so some OTs work within mental health, and that is looking at how we can use occupation, so doing stuff, to help mental health and well-being. That's how OT generic started in the beginning, was through that, was realising that actually people's mental health was so much better once they were out and doing stuff, such as sports or crafts or activity, whatever it is that you love. We want to enable that because it ultimately brings positive health experiences. So I'm a paediatric occupational therapist, so I work with children, specifically children with special educational needs. So that means I'm looking at children and their productivity, which often relates to handwriting and school-based tasks. But I'm also really interested in their play and how they play, as well as toileting, dressing, and their eating, to name just a few things that I focus on. Generically, an OT will go and assess someone. Might just use a standardised assessment, or they might just observe and analyse their behaviours, and we basically look at where the difficulties lie and how we can set some goals with the child and the family to help facilitate what they're wanting to do. And then we kind of give advice and help, and maybe some therapy if necessary, to kind of help facilitate their independence in that area. Another big area of my job is equipment, and knowing a lot around equipment to kind of help facilitate independence. So that might be kind of specialist seating, adaptive aids, all that kind of stuff. We're also heavily involved with special needs schools, kind of looking at sensory diet, sensory needs of children. And in the UK, we currently are working with EHCPs, looking at provision within them as a legal requirement. And sometimes potentially working with tribunals, helping families to get the right needs for their children. One thing I would like to say is that OTs don't have magic wands. They didn't give us one when we qualified from uni, sadly. But we can't solve every single problem or every issue that a child may have. We aim to kind of help and facilitate as much as we can. And therapy works best when it is done regularly. And I mean every day. You can't get fit if all you do is go to the gym once a month or once a week even. If you really want to see results, you've got to go every single day and really kick up the practice of that. And it's the same with therapy. It needs to be done every single day, ideally, and that's not possible. I can't come to your house every single day to help your child use their cutlery, but you can. So what we as therapists want to do is enable parents, teachers, whoever is working with those children on a daily basis to do the therapy and teach them how to do it, so that that child has the best chance of learning those skills of independence. And that's the way that I really love to work. I love to equip parents and teachers and any other work professionals that are in their lives regularly to help facilitate their goals. So I love OT, I love occupational therapy. It's a real passion of mine. I love to see children enabled for the things that they love to do. And I just hope that some of these videos really help inspire you to try some bits with different kids. And even, it's called OT Top Tips because it's not a full assessment. It's not at all. I'm literally just offering you little bits of advice to try here, there and everywhere. And I just really hope it's useful for you guys. Thanks for listening. Subscribe and like. I'm hopefully going to post out some videos soon. Thank you very much. Thanks. Bye.